Anna, welcome back onto the podcast. Round two.
Thank you, Ron. A pleasure to be back.
Early start for both of us. 6 a.m. where you are, 6:30 for me. And winter in Melbourne, so people can't see you, but you're all rugged up. I'm sitting in a T-shirt because I've just come from the gym.
I am a bit rugged up, yeah. It's fresh this morning, but it's all right. The sun will be out soon, hopefully.
Yeah, well, it's still pitch black here. It's been raining in Sydney, so it's very, very dark in the mornings. We'll kick off. We were just chatting off air, but this topic, and I mentioned it, I think, in one of my newsletters the other week about frozen shoulder and menopause and the connection there. And it's interesting that I don't know a lot about it. It's I'll confess there, but I've had a few people recently talk to me about this particular topic, and I really hadn't put two and two together. And then, a couple of female friends had said, "Oh, yeah, I've had frozen shoulder, and it was around when I got menopause and so forth." So I thought, given the audience, it'd be an interesting topic to chat about. Now, not my forte. I don't know how much you know about it, but I'm sure you've treated enough shoulders. Well, you treated mine post-surgery, so it's probably kind of similar. My shoulder's pretty frozen after surgery.
Oh, no, that's different. That's different. That's just
Yeah,
post-surgery
yeah.
stiffness. Very different to what happens on the inside in a frozen shoulder.
So just quickly for the listeners, can you just, in very layman's terms, explain what frozen shoulder is?
I certainly can. So frozen shoulder is a condition where the capsule of the shoulder joint, so between the top of the arm bone, the humerus, there's a ball, and then that connects with the edge of the scapula, the shoulder blade, which has a socket on it. So you've got a ball and socket joint sitting there. That is your shoulder joint, and around that ball and socket joint, you have a membrane or a capsule. And frozen shoulder, the official term for it is adhesive capsulitis, which is a bit of a mouthful, but it basically means adhesive means sticky, capsulitis literally just means inflammation of that capsule. So what happens is that membrane or that capsule around the shoulder joint becomes very, very thick, tight, and inflamed, and severely restricts the available range of movement at that ball and socket joint.
Yeah, my understanding of the shoulder joint, it's a pretty horrible joint as a whole. It doesn't have a lot of stability, and it's one of those joints that it's easily injured. You fall on an outstretched arm, and some people unfortunately have very unstable shoulders where they can actually dislocate or pop out pretty quickly. But this frozen shoulder, look, let's just walk through. First of all, there's some sort of connection there with menopause and perimenopause where there's a drop in estrogen and the collagen production around, which starts to cause some of this tightness of the shoulder. Explain a little bit about that, what's actually going on there.
So through women's ages of sort of between 40 and 60, which is a pretty broad range, but women undergo a lot of fluctuations in their hormones in the body. And one of those hormones is estrogen, which starts to reduce. Normally estrogen, one of the major roles of estrogen in the body is that it regulates and metabolizes a little protein in the body called collagen. And collagen's role is sort of the scaffolding, if you like, of a lot of the tissues in the body. It helps to support and strengthen, give elasticity to the tissue, so it keeps them pliable and a bit stretchy. And that includes not just capsules, but even your skin, muscles, tendons, ligaments, cartilage. So through the drop in estrogen, then the collagen also reduces, and it's not really playing as efficient a role in the body. And as a result, some of those tissues can become much less elastic and can lead to conditions such as this frozen shoulder.
So, given that I've never had frozen shoulder, I've only had post-surgery shoulder, and I'm assuming that you've seen a few of them. just explain a little bit like what it actually feels like, or what I'm not too sure if you've actually experienced it yourself, but what people are actually describing to you and what that actually process, or what are the symptoms they initially come in with, and what should people be looking out for?
Yeah, so thankfully for me, I've never experienced it personally, but yes, I've seen quite a number of people with it over the years. Um, and they often come in a little bit down the track. So it's not necessarily, well, it can be acute onset, but more often it's not necessarily one incident that causes it. So they're usually looking at a gradual increase in pain initially, and a reduction of movement. So they might be limited in certain movements like reaching behind their back, reaching up, hanging washing on the line, reaching sort of back and up over their back and up and behind their shoulder, say, for example, to grab your seatbelt. So some of these daily movements that we all take for granted do become quite limited and often very, very painful in the earlier stage of the frozen shoulder.
Yeah, that kind of makes sense. A lot of sort of typical movements. So one of the questions, I was chatting to a friend of mine the other day, and I think a lot of people with a lot of injuries, we make the mistake where we um, disengage and stop any type of movement because of, we get a little bit concerned if you don't understand some of these injuries. So we stop, training and movement altogether. Um, Understanding today that most injuries, they're better off with some sort of movement. So we actually keep these, the muscles sort of quite strong around that area. What's the recommendation to people around movement? And we'll get into a bit of a physio program in a moment. But so first of all, I suppose, should people keep moving their shoulder, and should they continue to go to the gym and try and find ways to actually work around these type of injuries?
Yeah, absolutely. So um, often people, when there's a lot of pain present, people are often afraid or unsure, and they tend to not move the arm. So creating that sort of immobility, I suppose, or restricting the mobility of your arm can actually worsen the condition. So you are better off getting some gentle movement into it. And I guess, seeing a physio in that sort of first stage of the condition can certainly help with guiding you through the right movements. Um, Often gentle movement in a non-painful range is recommended in the earlier stage. So you don't really want to be sort of pushing and forcing it into ranges that are really uncomfortable and causing a lot of pain. So a physio can help guide you through that. But certainly keeping movement and strength around all the rest of the body parts can be really advantageous as well, and keep you in a positive mindset through this long and frustrating condition.
Yeah, I think there's a big way, and I say this to everyone. There's always typically a way to work around particular injuries. And um, my friend I was talking to the other day, they're on a bit of a roll with their training, and they've been really enjoying going to the gym. And this frozen shoulders come along, and now all of a sudden they've lost a bit of their motivation. And I was trying to encourage them to say, don't give up your training altogether. There's still things you can do in the gym. You can still do a lot of body work. You can potentially still do things, that won't cause pain, bicep curls, tricep pushdowns, whatever it may be, where the shoulder's not actually being fully engaged to lift above your head. So I'd highly encourage people to don't give up your program altogether because you might be going through this frozen
Yeah,
shoulder process.
absolutely. Even some light to medium load on the shoulder muscles, but at that range where your elbow stays reasonably close to your body, as you said, like the bicep curl, for example, can still be really, really helpful. But you're not trying to push it up into that sort of shoulder height range necessarily, or certainly not above the shoulder in those early stages.
Yeah, for sure. What's the now? I was doing some reading myself this week about frozen shoulder, and the time frame can be quite long. I had no idea about the
Yes.
the time frame for and how long these can actually hang around. And I'll just read through the three stages that I was reading about online. It's the freezing stage, gradual onset and pain worse at night, painful at end of range of movement, can last for months. The frozen stage, pain eases, stiffness dominates, movement is generally restricted. And then the thawing stage, stiffness gradually resolves and can take up to 26 months in total. So they're pretty sort of drawn out, or can be a pretty sort of drawn out sort of condition.
Absolutely. I think that 26 months in total would be a pretty good outcome, to be honest. They often drag on for even longer than that, up to sort of 3 years, which, I mean, it goes without saying that's obviously going to be extremely frustrating for someone suffering from this. But I think if when you do get the diagnosis, really important to get the right education on exactly, as you say, just the length of time that this condition takes. If you're expecting to get better in 3 to 6 months, then you're probably kidding yourself and you're only going to get frustrated and lose your motivation, and this thing's really going to get you down. So I think having someone explain the length of time it takes with this condition can be really, really helpful. And frustratingly, there's really not a lot you can do to speed up that length of time. So you really just have to be a little bit patient with it and, I guess, respect the shoulder and what it's going through, and then, you know, treat and manage each stage appropriately so that you don't set yourself backwards. But yeah, so stage one, where it's sort of becoming frozen, significant pain, lots of nighttime pain, poor sleep, and often, as we mentioned before, those already going through those hormonal changes through perimenopause and menopause will often, for other sort of metabolic reasons, they'll often have interrupted sleep anyway or poor sleeping patterns, which um, just sort of adds to that spiraling frustration, I suppose. But certainly in that first stage, which can last up to about 9 months, where the shoulder is freezing, um, sleep can be really affected, which can significantly affect you just from a psychological point of view as well. We all know when you're sleep deprived, it just adds to the woes of what you're going through, right?
Yeah, horrible. Tell me, with things like, and this is just me thinking about my sort of past as well, will heat actually, assist with that?
It
Um,
certainly can. Yeah, yeah. Heat is definitely one of the recommended modalities. So any sort of warmth around the shoulder, wheat bag, whatever it might be, hot shower. Um, Particularly putting heat on it before you go through uh, a short series of exercise or movement. So the heat can often soften the tissues around the shoulder. It can assist with a little bit of pain relief, so that you get a little bit more effectiveness out of that series of exercises.
and what about ice? Although I understand that, cooling and icing has become probably less important these days. It used to be the old, when I was younger, it was, the old rice, the rest ice
Yep.
compression elevation days. But, and I know for me personally that ice seems to be a very good pain reliever due to the numbing effect
It,
that you get from it.
yeah, it certainly does. Ice can definitely be useful after going through your exercises. So the pattern generally, well, the recommended sort of pattern protocol would be to heat the shoulder first, run through your series of exercises, and then once you're done, get some ice around it, so that then you're reducing any flare up of that inflammatory process inside the shoulder. But ice can definitely be helpful.
Yeah, and definitely from a pain management point of view, I know with these new ice machines, and I think Mick has an ice machine at home. I know that one of
Yeah, he
my
does. Yeah.
buddies in the US was involved in a rental business of ice machines for post-surgery people, and they just,
Yeah, right.
wrap around your knee or whatever you've had, and they just run ice water through these things, and you can sit at home. So that's definitely something worth investigating. But I'm a massive heat person. With anything that I've got going on, I'm sitting on a heat pack right now. My lower back is a little bit stiff, so I've got one stuck behind my back.
That's why you're
So I've
sitting in a
always got a
T-shirt.
heat pack with me. Yeah, exactly. Um, So if somebody thinks they're going through frozen shoulder, let's talk about a little bit about the process here. And given the fact that this initial process can be quite long, and you mentioned before that it's a little bit frustrating, not a huge amount you can do about it. But should somebody still go and see a physical therapist to actually get a proper diagnosis? And, because they may have a rotator cuff tear they don't know about or something else going on. And I'm
Yeah,
assuming in that
absolutely.
situation, you could do some testing. And then also, I think the big thing that you hit on before was keeping people motivated throughout this process. So you might have somebody, and given the fact we're a fitness podcast or a health and fitness podcast, somebody that's just starting out their fitness journey and then they go through this frozen shoulder. I'd want that person to still find a way to do some exercise. Or you may have a person that's, in the middle of their fitness journey or been training for some period of time, and they go through this process and they get really frustrated and want to stop training. So I think it's important to actually find ways. So when should somebody see a physical therapist? Given this early stage of frozen shoulder, there's not a huge amount you can do about it, but I suppose the correct diagnosis is always important.
Yeah, absolutely. So a physio can assess the shoulder, and then often you often get multiple pathologies at the same time. So sometimes a frozen shoulder is not there just by itself. There might also be rotator cuff pathology or damage in there also. But I think when the frozen shoulder is present and diagnosed, that tends to be the one that takes priority and certainly takes the longest. So yeah, physio can take you through. They'll obviously ask you a lot of questions. They'll look at your available range of movement. And one of the major diagnosing factors clinically, like in the rooms with the physio, um, is a reduction in range of movement whereby the active movement is the same as the passive movement. So what that means is the physio might get you to tuck your elbow in beside your ribs and get you to rotate your forearm out to the side, sort of like you're opening a gate. Often that movement, that external rotation, is the one that's quite significantly restricted. So they'll get you to do it on your own with your own muscles and see how far the arm can rotate out. And then they'll repeat it by they'll take the weight of your arm so you stay nice and passive and relaxed. And the physio will move your arm through that same direction of movement. And if the range is the same, then that's a pretty key indicator that there might be a frozen shoulder present. Often what we find when there's not a frozen shoulder is that when the physio moves your arm for you, the range is actually a lot more. So if there's a difference between that active and passive range, it's much less likely to be a frozen shoulder. Um, However, imaging is, that's the thing that's really going to pick it up. So an MRI of the shoulder will show what the tissues look like on the inside, and that can certainly pick up that the adhesions and that sort of thickness, stickiness of the joint capsule there.
Yeah, that's interesting because I wasn't aware that the imaging would actually show that in any sort of detail. So that will show you can actually diagnose frozen shoulder from an MRI.
Yes. Yeah. Well, in
Yeah,
my experience, certainly, yeah, MRIs have shown it. Yeah.
yeah. So it makes sense. I mean, it's one thing from my many, many years of running and coaching is that anytime any of the boys got some sort of injury, which wasn't very clear to us, and obviously we suffered a lot of running injuries, so you get pretty familiar with what's going on with your athletes. But I would often, and we're fortunate in Australia, it's pretty easy to get an MRI here. The process in the US is quite sort of lengthy, and I don't fully understand it, but I know when I try to get one there, you've got to go through this whole process. You can't get recommended by a physical therapist. But so we use MRI as a diagnosis tool quite regularly here, which I think is a really good thing to get an accurate, because it doesn't
Yeah.
matter how, from a practitioner's point of view, you may be an extremely good practitioner, but the diagnosis part is really important so you can start the right treatment. And sometimes you just miss a few things, right?
Oh, absolutely. And you don't want to go through the process of explaining what a frozen shoulder is and how long it takes, and often that's big information for a client to take on board. If you're just basing that on only your clinical assessment without that imaging to back it up, I guess you want to be pretty confident in your diagnosis. Otherwise, you're otherwise you're basically yeah, scaring someone with all this big information that may not actually be there.
So typically, a patient's presented themselves to you, you've diagnosed a frozen shoulder, whether just clinically or with an MRI. What's the next step for that patient? So they're pretty early. They've actually had a bit of shoulder pain for 2 or 3 months. They wasn't too sure what it is. They'd ignored it initially. They've actually come to you. What's next for them?
What's next for them? So they process it in their own mind first and come to terms with the commitment, I guess, the commitment that it takes um, to work through each stage. Um, Initially, some hands-on treatment can offer some pain relief. So your physio or your practitioner will guide you through some strategies to try and help manage that pain in the early stage. And then they'll also guide you through what movements are going to be safe and useful and not aggravate things. Once you hit the second stage, where it's actually officially frozen, which is a lot more sort of chronic, it hangs around probably from about 9 months up until about 15 months. Um, and in that phase, you're really, really limited in your range. So the shoulder joint itself, that ball and socket joint, is really extremely rigid. You're quite limited in what you can do day to day, can be extremely frustrating. Again, in this phase, it's the exercises that really play an important role, and your physio will guide you through the right exercises for you through that stage. So a lot of the management will be you committing to doing the exercises at home, um, and then your physio guiding you through the progressions of those. In this phase, you may or may not have a lot of hands-on treatment. Sometimes the hands-on treatment can help to alleviate symptoms around the shoulder. So really commonly we would see a lot of tightness through the neck and the upper back, just due to compensating strategies that people just subconsciously take on board when they're trying to still do things around this really stiff joint. So a lot of the treatment in that phase, apart from exercise prescription, is actually treating things around the shoulder itself.
Yeah, that makes sense. And you probably get people presenting with, as you said, other stiffness in the neck and other parts of your back. And when I was chatting to my friend the other day, they were saying that they had a really stiff back as well. And I'm assuming because they can't move their shoulder, they can't reach, so they're trying to
Yeah,
rotate. More than likely in the car, they can't reach behind them, so they're probably trying to rotate too far around. And now it sounded like she'd actually either you know popped a rib or just strained a rib or cartilage area. That classic when you rotate too much and you actually end up.
yeah,
And she was saying it was hurting her to breathe and she couldn't turn. And I'm like, yeah,
yeah,
you get all
right.
these secondary type aches and pains when one part of your body, and that's pretty normal when one part of your body doesn't work very well. You're trying to compensate. Um,
Yeah.
Tell me, does intervention with cortisone injections or anything like that assist?
Look, it can. So basically, yeah, the options for treatment you're looking at physiotherapy through that whole journey, through the whole process of the 3 stages. There is the option of a corticosteroid injection into the shoulder, which certainly has been shown to give really, really good short-term relief. It definitely does not reduce the length of time that this condition takes to get better. And all the studies that I have looked at show that there's no long-term benefit from having a cortisone injection. So really the pluses of a cortisone are that it gives you some relief at the time and for a short period of time, which can be certainly very worth it for people. Um, once you get to the end of the journey, uh, someone who's had a cortisone or multiple cortisones versus someone who hasn't, they basically end up in the same spot.
Yeah, makes sense.
Yeah. One of the other options, a hydrodilatation, so slightly different to a cortisone injection. So a hydrodilatation involves an injection of just fluid, so just some saline inside the joint, so inside between the ball and the socket, and injecting that fluid basically helps to stretch out the capsule from the inside. So whilst that can give a little bit of discomfort and pain short term for a few days afterwards, um, that can assist with just getting a little bit more stretch in that capsule. Um, Apart from those two injection options, you're looking at more invasive interventions. So some people undergo surgery for this condition, which would certainly not be my first choice for someone. I guess if conservative management, as in, the physio and the exercises, if that's getting you nowhere towards that third stage, some people end up having to undergo surgery, whereby they do an arthroscope, put a little camera in there, and then they actually release the capsule. So they release part of that tight capsule via surgery, but then obviously you've got to recover from the surgery as well after that. And then your other option, which also involves a general anaesthetic, like the capsular release, the last option is a manipulation under anaesthetic. So you undergo a general anaesthetic, and then the surgeon moves your shoulder in all different ranges, further than it would if you weren't under a general anaesthetic, which also helps to sort of stretch out and free up that capsule a bit.
Sounds horrible.
It sounds horrible. If you can get through it just with physio alone and some exercises and some pain relieving modalities, that's certainly the recommendation from me.
Yeah, it's interesting. I suppose it's one of those things from a surgical point of view that at what point do you entertain that? If it's a 3-year type of recovery for these to get back to full mobility, at what point does somebody feel like they need to go and have surgery? Based on that data alone, from a personal point of view, I'd want to wait the full 3 years. I would just avoid surgery at all costs. Even though I have gone through shoulder surgery myself, but it was necessary, but I would just avoid that because it's not pleasant and the recovery is pretty slow as well. And for a lot of people, if you're not really disciplined with the work, and I know a few other people I've spoken to that have had the same shoulder surgery as myself, and they're still years later can't use their shoulder to any capacity. And I don't put that down to the surgery. I put it down to their rehab and their
Yeah,
recovery protocol they
yeah,
put in place. They just weren't disciplined, and they would just let things get away from them.
yeah. And with that point about at what stage would you consider surgery, um, I'd like to think that a surgeon is not going to be willing to operate too early on in this process anyway. They're gonna say, wait it out a bit, do some rehab, see what the effect of that is, and then reassess. And if you're just getting absolutely nowhere and things are taking way longer than we expected that they would, then a surgeon would be more likely to entertain the idea of one of those surgical options. Yeah.
Yeah, sounds yeah. Hopefully that's the case with surgeons, that they don't just need to go on a European holiday and put you under the knife
Yeah,
because he
correct.
needs to pay off his credit card. I have heard of people. Now I don't know if it's the same frozen shoulder, but I've heard of people actually when they've had surgery having some sort of frozen shoulder post surgery, and this was in a much younger person. This is someone in their early 20s. Is that the
Yeah,
same thing?
it's the same thing, just a different onset. Yeah. So after undergoing shoulder surgery, not for a frozen shoulder, um, often you're quite restricted in your movement. You might even be in a sling for a period of time, depending on what the surgery involved. But that immobilization can sometimes lead to that stiffness starting to develop um, within the shoulder. And depending on the person, there's other risk factors, I suppose, that would make someone more prone to frozen shoulder in that circumstance compared to others. Like if they've got any pre-existing diabetes or autoimmune conditions, so where the immune system may be slightly compromised. Um, yeah, conditions like that can also predispose you to being more likely to get a frozen shoulder.
Yeah, interesting.
Mm,
Well, we've been 30 minutes. Both of us probably have a day in front of us, so I think
we do.
that's pretty good information for a lot of people. Definitely clarified a few things for me because I'd heard of it before, but hadn't really put the two and two together when it was in in and around more women actually in their 40s or 60s get frozen shoulder, and there's a high correlation to perimenopause and menopause there. So that's interesting. But hope people enjoyed that podcast, and thank you again, Anna. But we're going to have a regular slot now. Hopefully, we're going to try and get together monthly. We've got plenty of
Great.
things to talk about. We're never going to run out of bits and pieces in the body to talk about. So
That's
I think
true.
we
There's a
should
lot
get
of
at
bits and
least
pieces.
we should get 12 months worth of monthly
That's it.
podcasts, and I'm hoping a bit longer.
We'll go from head to
But
toe.
yeah, 100%. I might, with your assistance, put out a bit of an overview or a check sheet on frozen shoulder for people that I'll put up on my Substack as well. So, but
Sounds
thanks
good.
for getting up so early and jumping on the podcast with me again.
My pleasure. Thanks for having me.
Have a great day, and bye for now.
See you.